With 93 cases of the new variant detected in Gauteng as of this morning, 4 in Botswana and 1 in Hong Kong, authorities say it's probable that it's present in most provinces in the country. Provincial health authorities say it's likely that the increase in positive COVID-19 cases in the province over the last few days is driven by the new variant.
This new variant has been detected and it does have a high number of mutations. And because some of these mutations have been present in other variants, and we know what the effect was in other variants, there are concerns that this may be able to escape some immunity, especially from prior infection, and may be more transmissible. I'm sure as genomic surveillance expands both here and in other countries, we will see that this variant is probably already in other countries, including those that perhaps have limited flights to South Africa.
On the eve of the festive and peak tourist season, the impact of the temporary UK travel ban to South Africa has been cited as a major concern.
That is really why I'm calling for more research and clearer data on what this variant means. Is it something that is similar to the existing variant that we've known how to deal with, or not very different? Well, then we know how to apply our minds. Of course, what we will be doing is getting this data as quickly as we can so that we can engage at a national level with the PCC, all premiers and the presidency. But we need that data before we can make any calls. I think, as I've said in the beginning, I'm quite concerned with the closure of those flights. It's for this weekend, and that's why it is urgent that we get to understand the implications of the strength or the change or whatever this variant means to us.
Health authorities say the province is seeing early signs of a fourth wave in the context of the new variant. While 44 new diagnoses have been made on average daily over the last 7 days, hospital admissions and deaths, however, continue to decrease at this time.
In the metro, there's been a 47% increase. Again, small numbers in cases because of very low numbers. Most sub-districts are starting to see these small increases, but there's a notable increase in the northern and the western sub-district, especially from specimens done in the private sector. If we go to rural, most rural districts continue to see low case numbers, but there are signs of small increases in absolute numbers in Garden Route and Cape Winelands. And then the reproduction number, which is the one we always track, if a reproduction number goes above 1, there's an indication that we're having an increase in cases. So it is above 1 in the Western Cape, so that's commensurate to the increase in cases we're seeing.
Just over 42% of the province's adult population is fully vaccinated, with over 4 million jabs administered. Some 35,000 healthcare workers have to date received their booster shots. Authorities have urged citizens to adhere to the safety protocols of, among others, mask wearing, and have stressed that vaccination remains a crucial measure to save lives, protect the hospital system and the economy. Vanessa Puna, SABC News, Cape Town.